Hi, in today's lesson we're going to talk about headaches. As you may know, there's a whole variety of type headaches. There's tension headaches where there's a steady pressure. There's migraine headaches which affects the whole head, and you can see the forehead looks very pale. There's also vascular or pounding headaches that pound with the beat of the heart. Pretty much all these type of headaches generally come from the neck, especially the upper neck. As we said before in past lessons, all the vertebrae should be lined up nice and straight. Unfortunately, if one little bone tips a tiny little bit, it can affect this red wire here as a representation of our blood vessel. So just with a tiny little bit of turning, it can affect that blood vessel trying to get through. Well, the blood is supposed to flow through nice and freely. Well, unfortunately, if there's tension on that, the blood is trying to get through. So each beat of the heart, it's pounding in there. As I said, the other type of headache, a tension headache, is because of the type of job that we have. As a secretary, you're typing looking down. As a laborer, you're bending over in one position over and over again. Somebody that's doing troweling or things like this, they're doing repeated position or doing a repeated job that's more on one side. We're left-handed, we're right-handed. So typically muscles will tighten more and more. So what happens, instead of maintaining a proper alignment, the skull will tip a little bit. We're going to show you just a little bit on the chart of how this works. But the muscles go from the top bone to the skull. They're very, very tiny. But with tilting in the same position over and over again, it can cause pressure on those headaches.